Good morning, good afternoon, good evening, folks, wherever you are joining in from. My name is Abhishek Singh, and I'm joined by my colleague Durga to talk about a topic that both of us care for a lot. In fact, I'll give you some time to settle in while the folks join in. I just wanted to share a quick anecdote. Just 15 minutes back, I was dropping off my daughter to school, and she was asking, "Hey, why are you rushing? What do you have to rush back to?" So I was telling her, "Hey, I'm doing this LinkedIn Live. So what's the topic?" So I told her it's how to deliver hyper personalized customer experiences in life sciences, and she's like, "Oh my God, that's quite a mouthful. What does that mean?" We as researchers have kind of a expectation to live up to make some of these really heavy sounding words sound kind of understandable 101 to kids also. So I think, Durga, I'll need your help in kind of demystifying this heavily loaded word that we are going to speak about today. I don't know why. Maybe
Absolutely.
in the initial few minutes, maybe you might just want to tell us why are we talking about this topic today.
Definitely. I think that's some feedback I should definitely take. I mean, maybe not use such long and heavy words in the next LinkedIn Live topic.
In fact, folks who have joined in might want to share their own experiences or their own understanding of what we are going to talk about now. That may be a mystery for a few of you, if not for the folks who have probably dealt with this on a day-to-day basis. All right. So we are 2 minutes past the starting mark. Durga, why don't you just get us started on, hey, what are we really seeing as regards changing customer behavior and experiences when we speak of the life sciences spectrum? I think another way of putting the question would be, why are we really talking about this topic today?
Absolutely. I think that's probably the best question to kick this off, right? So, I mean, we were talking about hefty words, so maybe let me kick start with that itself. Personalization, hyper personalization, customer experience. All of these have been buzzwords for some time now. If every life science enterprise, especially the commercial functions, have been talking about it, have been trying to figure out how do I really make it possible, right? So, I mean, what really triggered this? I think we all know the answer. Pandemic. We have both positive and negative outcomes from the pandemic, but I think this is probably one of the positive outcomes where the industry pushed life sciences companies to think about experience in a way and thinking about it in a more customer centric fashion, right? So maybe let's start talking about it or map it from a pre pandemic stage, right? So how did really business happen back then? It was very traditional. It was very relationship driven selling, right? So sales reps would go to healthcare providers, build and nurture this business relationship, and that's how it was old style. It was that's why it's traditional, right? So that was pre-pandemic world. And again, pandemic hit. All of us were forced into working in a virtual fashion. So people had to figure out how do we make it happen, right? So they explored digital channels, not just healthcare providers, but also naturally enterprises also need to explore these digital channels. And once they started doing that, they've realized that hey, there are a lot of benefits. Actually, we've been staying away from these for quite a while. I don't know why, but there's a lot of benefit with it, right? And things started to open up, and people, I don't think people wanted to move back to the traditional way of it. They've gotten a taste of it, they like it, so they want to figure out a good mix between the traditional way of selling plus the virtual way of selling, right? So now it's very customer centric in the way now your enterprise needs to understand how does my healthcare provider want to interact with me? Which channel does he want to explore, right? For let's say something educational in nature, they want to sit back maybe on a holiday, read about it, right? They don't want to see a person at that point in time. Maybe a sales pitch or discussing in more detail as to hey, what's the value proposition, that's where they want to do it in person. So I think naturally the preferences have changed. Now it's about understanding that and aligning how you do business with those preferences, right? Customer experience is no longer a luxury, I would say, for enterprises. I think it's becoming a hard reality that everyone needs to figure out how do we make that happen.
No, absolutely. In fact, one of the questions popping up in my mind was even within the life sciences customer persona, is there a Gen Z profile that we look at? I mean, we talk about omni-channel experience in any industry that we pick, but when it comes to the sales or the commercial function of life sciences, it's not something new. People have been, I mean, medical representatives and PCPs, etc., have been interacting for years. But what have we seen change in their persona? I mean, is there really an online channel there happening which uh, kind of creates the preamble for something like hyper personalization that is now required? What is changing in the industry which is causing this to happen?
I would say, I think, see, earlier they were staying away from it, right? They were like, okay, hey, this is there, but I am set in my ways. I don't want to change it. I mean, I have done business traditional way. I don't want to be bombarded with new things. I have a lot to deal with my patients. I don't want to deal with digital. So that's how they were thinking, right? Now, because they were forced to do it and now they know what's the art of possible there, right? So they're like, okay, hey, this is good. I mean, it's really interesting. I mean, it's actually helping me reduce my burden. Like, it's helping me optimize my time, it's helping me do a better job with handling my patients, getting better in the way I'm gathering knowledge. So I want to do this, right? So now omnichannel was always there. It's not a new term. It has always been there. It has just not been adopted as much. Now it's, I think people will get bored of the word just the way people got bored of webinars few years back, right? So that, I think they might get bored of it in a couple of months down the line.
In fact, there is a comment coming from somebody. It says, starting an email with "Dear Doctor XYZ" isn't personalization, and that I think that's a good one. There's some bit of personalization there. I don't know if I can call it hyper, but yeah,
Yeah. No longer want to say dear sir or dear madam, right? At least take my name.
yeah. Let's not go there. We'll enter into a lot of other woke topics then. All right. So changing customer behavior, because when we are talking about hyper personalization, and it's quite a mouthful, I'm finding it difficult to pronounce it also. Uh, what are we talking about here? Is it like the different kind of products that life sciences companies are launching with for each of which there is a different context required in the selling environment, or even in the target audience, the PCPs, etc., are we noticing that hey, there is an explicit need that they are articulating that hey, my context is different from what it used to be. There are different swim lanes that you need to align to. Can you just explain that a bit as regards how this is playing out?
No, absolutely. I think earlier the way healthcare providers or were loaded with information, or sales rep used to take it to the healthcare providers, it's like, hey, I have this product, this is how it can help you. So it was very, if I may say, it was very brand based, a product or drug driven selling, right? So I have a product, I have a blanket approach for that to sell that product, and I'm going to use that approach to everyone that I meet who's a potential customer for this. I don't think it's going to work out that way. Now it needs to shift to a customer centric selling. So let's say dear Doctor XYZ is sitting in a healthcare facility, right? In some geography, you need to understand which TA is he, he's known for, which geography, in which chain of hospitals does he sit, what are all the products that I have will be relevant for him or her, right? And then I take a very customer centric selling. Hey, you know what? I have all this in my portfolio. This is how I can help you. Instead of saying I have this one drug, this is how it can help your potential patients. And do you actually have those patients? How many? Is that your top priority of all the areas that you cater to? I think you need to figure out that, right? It's nowhere, it's no longer going to be one blanket approach that's applicable to everyone. You need to have a very customer centric selling approach. So designing a way to take it to a customer based on his choices, based on the ecosystem that he's sitting in.
So what does that mean from a tech standpoint then? How is technology helping in this? I know we come from a world wherein we look at everything from the lens of technology. So we kind of wear these tinted glasses. Would love to believe that, but you come from the core of the industry. You have seen the other side also. So how is technology aiding it?
The question should be, is it helping it as much? Probably. So maybe this is one question we might want to ask the people who've joined in, right? So I want to really understand. So the CRM technology that you have deployed in your current ecosystem, is it really helping you drive hyper personalization, right? And I mean, I would be really interested to see everyone's thoughts here. While those thoughts, keep coming in, so we've just run this recent poll last week, and the results are crazy, right? I mean, I don't want to say that out immediately, but maybe we just give everyone a minute to share their thoughts.
No, absolutely. Let loose all the banter that you have about this topic, because in many ways, when it comes to technology, uh, having been this in this space for over 2 decades now, the market is largely supply led. Suppliers end up defining what the benefits are, and organizations, enterprises tend to react to it and try to fit in with their existing businesses rather than, hey, it's a need based kind of innovation that's happening there. So what ends up happening is that once you have that system and then you start figuring out what to do with it in a lot of scenarios, whether it's CRM, whether it's ERP, for all of these, we have seen similar situations play out in the market. So, what's your experience? Do feel free to write about it and feel free to be honest. I mean, there is nobody here who has any stake in a manner that would preclude them from liking or disliking any aspect of technology that exists here.
Yeah, I think that would be interesting, right? And especially, I mean, I knew the answer, but I was surprised to see the number, right? When we ran the poll last week, so almost 80% of the people are unhappy with their CRMs. They say that it doesn't deliver hyper personalization, and that's really interesting, right? And let me bring up this one slide that might put some of this into better context. So if you look at this, on the left side is what you see at all the functionalities that a traditional CRM would offer, right? What is a traditional CRM? I would probably call it as a system of records, which just keeps a track of what are all the conversations a sales rep might have had with a healthcare provider, when, what was the conversation about, right? It's not really giving me any insights. It's just keeping a track of all my activities, right? Basically, it's bringing together a lot of data that is like humongous, which you need to like sift through to really understand what's happening. That's what traditional CRMs are. Right now we are talking about all these words like personalization, experience. How are you going to drive experience if your technology that is supposed to help you do this is not as savvy, right? So we are talking about how the traditional CRM needs to evolve to a customer experience platform, and what does it need? And that's what we've listed on the right? The experience functionality, so all the jazzy elements that are needed to make the personalization happen. Now, naturally, there are a lot of things that can be done. You want to prioritize, because that's how it happens, right? It's a long journey. Nothing is going to change overnight or even in a year. Things take time. So what's the first thing that everyone is really trying to figure out? And again, this is also one of the poll that we ran last week, where we wanted to understand, hey, what is it that you're expecting from your CRM to deliver hyper personalization, right? And more, the top two things that popped out were understanding my customer in a dynamic fashion, right? That's dynamic customer 360. So again, we were talking about how everything is about customer preferences, customer centric, right? So you need to understand your customer from all angles possible, right? So all the digital channels that they're deploying, their social media presence, which webinars they're attending, maybe are they on this webinar, maybe not, right? So that's really understanding, getting a dynamic view of your customer, and then deploying analytics to understand how do I make use of that information, right? So they go hand in hand, and only if you have both these pieces come together, that's when you can make true omni channel that's personalized really happen. So that's how we are looking at the commercial technology landscape right now, I wouldn't say it's equipped. It needs to evolve, and that's definitely a journey ahead.
Yep, yep. In fact, hold on to that thought. There is a comment there which I'd like to bring up. Pharma CRM today, no, they are the one following it. Pharma CRM today is essentially rep centric. So if we were to just cut our call today, right now, I mean, right now, this probably is the money statement, which should make
Yeah.
people kind of reflect on and say that, hey, we are talking about customer experiences, but what we have as reality is that pharma CRM today is largely rep centric. Where is the customer centricity in it? So I think when you're talking about the shifts in many ways, that system of record thing, who is it really helping? And who is it delivery value for? I think that's the basic or the main question that should be asked of all people who are implementing technology today. Whoever posted this comment.
Yeah, absolutely. In fact, on that note, right, I think it's people think of when they think of customer experience, they think only the sales team can make it happen. And I'm really wondering how can you think of it, right? I mean, what about your marketing team? What about your medical affairs team? I mean, you need to for you to really make these customer experiences that we're talking about, you need all your functions to work together, right? It's no longer about just the sales rep or the sales team. It's beyond that. Now you need all your functions to work together, integrate well, integrate the data they hold on each of the customer, and that's really important, right? So I think that's a great thought, and really talks to the current state of the industry.
Yeah, let's take another question that has come up. It's a longish one, so I'll try to read it slowly. The question goes, would you say that one of the big shifts is moving from a deliberate process of minimizing the number of customers that an organization chooses to engage with, that is targeting, to how a life sciences company can make itself relevant to all customers as a starting point, and then make a resource allocation decision as to how to work best with distinct customers? Hmm. That's an interesting
Yeah.
one because, in many ways, when organizations started implementing enterprise tech, whether it's CRM or ERP, collecting information about most customers, if they could, the idea was essentially what is mentioned as the latter part of the question. Like, hey, we will have the world view of all customers, and then we will start building distinct swim lanes. Interesting aspect, what you're mentioning, whoever has asked this question, is that, hey, can there be a thought process in which customers deliberately start moving to the limited number of customers? I don't know if that is happening, but a corollary of this is what we are seeing in biopharma, wherein we are seeing these cell gene therapies coming out, gene specific drugs, etc., coming out, wherein the targeted audience itself is very small, limited, and aligned to certain criteria. For such organizations anyway, the PCPs that they deal with, who are catering to those kind of target audiences, patients, etc., is limited. So for them, it's a natural play that is happening there, and maybe technology can play a role in helping determine that. But I don't know, ma'am. Durga, do you see organizations kind of doing what is mentioned as minimizing the number of customers that an organization chooses to engage with?
In fact, this is an interesting question, right? I mean, that kind of got me thinking. If you ask an enterprise, hey, do you want to reduce your target pool base? Their immediate, natural, instinctive answer will be, hey, no. I mean, why? Why would I do that, right? Again, I think maybe they'll take a different approach here. I don't think they will limit the number of customers they would like to target. They may take a one way to think about is, sorry.
Maybe a specialization. We are seeing a bit of
Yeah.
shifts happening like in pharma, like some organizations are pivoting towards, say, vaccines more and divesting their
Hmm.
consumer product businesses, etc. So we are becoming more specialized.
Absolutely.
So something
Yeah,
like
and
that.
the angle I was taking is a more geocentric angle. So maybe they'll try and test it out in certain geographies, before taking it global. So again, maybe a different angle to the way you're positioning specialization. Maybe try it in pockets instead of limiting your overall customer base, and then take it more global.
Yeah, I mean, we can maybe borrow a leaf from how technology companies do proofs of concept. But in
Yeah.
pharma, it's very difficult to do, especially when it comes to drugs, etc., because the base business case for the launch of any new compound itself is looking at the total addressable market, and you have a limited time to get to monetize it for whatever runway you get for the patent period.
I'll
So
grow old and I'll grow gray hairs by then.
I'm not. I have never been in core pharma, but my hair is still gray, so I can imagine what people in pharma are dealing with. So, all right. So, since we are on this topic and we are talking about technology, and there is a lot of banter coming in about hey, technology and technology's role, whether it's customer centric, whether it's rep centric. One of the things that we have done is look at the entire CXP market through our very recent peak matrix evaluation. Would you want to show the audience of what we figured out there? Obviously, picture may not be all rosy just because there are a lot of players out there offering technology in the market, but I'm pretty sure there are a lot of shifts taking place from which enterprises, life sciences, biopharma customers can take heart from, and they can see directionally where this is headed and figure out a few use cases wherein they can directly apply technology to get what we are trying to achieve here, which is customer experience.
Yeah, absolutely. So again, I think I will not. This is the view that Abhishek you mentioned about, right? Again, this is essentially our take of all the customer experience platform providers that are out there in the market. So for people who are seeing a peak matrix for the first time, I'll just maybe shed some light on what a peak matrix is. So this is our proprietary methodology to benchmark vendors and on any particular theme, right? So the theme here we are looking at is life sciences customer experience platform. So what we do is we benchmark the capabilities on a 2 by 2, and on the x-axis we look at vision and capability. That's what is it that they have, and on the y-axis what is the kind of impact that they're creating for the industry, for their clients, and what kind of market success they're seeing, right? So this is exactly that map. I would think that none of you would be surprised by the names in the leader box. But one caveat that I would like to add is, although this is customer experience, the a representative of a customer experience platform analysis, we were discussing just a while back, right? Customer experience is traditional CRM plus experience functionalities. Will I say all the leaders have everything experience related? Maybe not, right? Everyone is on their journey. The leaders that you see, they do hold the pie because they've started their journey long back. They've set their credibility on the traditional CRM side, and they've captured a good market right now. I think every player that's on the chart needs to make credible investments to move towards the customer experience platform that we are talking about, right? That's one caveat that I would definitely like to add. Largely, again, two types of players here. One is the ones who've been there in the market, who have built their capabilities on the CRM side of the house and have good credibility in the market. So Viva, again, we all know it's a market incumbent when it comes to the pharma side. Salesforce holds the power on the medtech side, and again, we do have some other industry agnostic players as well, right? For example, like Microsoft, who also have some play in the market. These guys have definitely strong CRM capabilities, and they are definitely increasing the pace at which they're adding more experience functionalities, because now they know that hey, they need to evolve their CRM. And if the numbers are saying that people are not happy with CRM, that means they need to do something about it, right? So naturally everyone is looking to evolve, so everyone is on that journey. And the second set of players are some very domain specific niche players who've in fact started their journey with the customer experience messaging itself, right? Again, some players like Xevo, Trueblue, who have started their story with customer experience as their initial messaging. So that it'll be very interesting as to how each of them will, where will each of them be probably 2 to 3 years down the line. Who's going to steal from whom? Especially with the Viva Salesforce divorce, I think things are going to get a lot more interesting, a lot more freedom, a lot more room for opportunity. So I think it's going to be a hell of a journey to watch out in the next 1 2 years.
Absolutely. And folks, for the folks who are listening in, feel free to chime in your comments about your experiences working with these platforms also. I know there's a lot of banter coming in. In fact, one of the comments mentioned here is also interesting, which says, in the traditional model, the number of reps you have dictates the size of the addressable market. A CX model has to change that. I recall a conversation a few months back wherein we were discussing, hey, how commercialization in a box is becoming an important aspect of how organizations want to go about launching drugs, etc. One of the things that is very, very palpable, and I think that's where the XP platforms have some thought, need to have some thoughts around how they extend the value of their product, so to speak, is for a lot of organization, life sciences organizations, having a channel is as important or if possible more important than having a product. A product without a channel versus a channel without a product, if you have to compare those, I know Durga, you're smiling. We have discussed this joke a bit in the past also. Sometimes I have seen that having a channel without a product is more valuable than having a product without a channel sitting in your midst. So that's a reality that a lot of organizations have to deal with, which also brings to bear if you look at the another comment here, which says if the majority of the market are using a CRM that has no marketing or service functionality, I think you have the answer. That's another very nice, precise comment coming about how CRM functionalities currently are, the current state of it, because you have a system of record, but if it is not interfacing, giving you the direct interfacing requirements and creating the tip of the spear of how you engage with customers, there is something missing from that. And that's the difference between the change between it's from a CRM to a CXM, the R to X. Oh, it's nice one, right, Durga? RX.
Yeah.
Yeah, so that shift is needed, and unless that happens, most technologies sitting in enterprise environments in the pharma side will not deliver what just by the word of it they promise, and it'll become another uh, tongue twister that we have. Like we are talking about hyper personalized customer experience, quite a mouthful, and these mouthful kind of terms and terminologies being thrown around the tech world and entering into the pharma space. Not that pharma is anyway short of terms and terminologies, will just create more confusion around how what's the value or the leverage that we can get from it.
Absolutely. And I see one other interesting comment, right? From Michelle. Shouldn't medical and marketing be working together and not overwhelming an HCP with same information? Exactly what we were discussing a while back, right? It's you can't you need to have your individual business functions working together. You can't have them working in a siloed fashion. So absolutely, I think I can't agree more. You can't bombard them anymore. You make sure you're sharing what they want to see for sure.
Absolutely. So we covered the peak matrix, and there was one trailblazers we did, right? The firms who are
All,
like,
all, all big words.
let's
Yeah,
talk about that.
absolutely. Absolutely. In fact, there's a comment I would probably like to, talk about first. There's one comment from Claude. When you look at the market trends within AI development, it's interesting to look at how many market leaders and major contenders actively use AI to drive personalization at scale and achieve commercial excellence. Absolutely, right? I think I wanted to use this as a cue for the Trailblazers one because it's very interesting. The extent to which data analytics and AI is now being leveraged, again, we've talked about it, right? It's in the top investment priority for enterprises to unlock personalization. So naturally, the existing players don't have it all. And let's agree that, right? So they're an interesting set of players that are coming up on the market, right? Again, these are the trailblazers that we are talking about, and the kind of what is it that they're really bringing to the market? It's actually analytics and AI capabilities, right? So they are bringing in commercial analytics and AI capabilities so that they are able to bridge the gap from a CRM to a CXP. And how is it that they are making this happen? Everything, it's a very domain specific approach that they're taking. They're not bringing something that's industry agnostic and trying to fill a gap, right? A lot of big players already have this, so not definitely not making the cut. So what these the way they're differentiating themselves is They're bringing in a very domain specific solution. They understand the industry, they understand the language that the industry uses, which becomes really important when you're looking to understand data. So domain specificity is definitely the top thing that stands out for these guys. And two is a very innovative focus, right? So they are identifying what are exactly these white spaces in the market that are needed to be targeted for that CRM to CXP shift that needs to happen, right? And they're exactly targeting these pockets, which is like, if I have an existing CRM already, I might as well bring these guys and, plug those gaps. So that's exactly what is differentiating them. And some of these guys are gaining significant mind share with top enterprises, right? So this is very interesting, and I think I would like to see the journey of some of these players in the near future. How are the big guys going to acquire these, partner these? What is it that they're going to do, right? It'll be very interesting to watch out.
I like to take the safe way out by using the term ecosystem. Whatever happens in the ecosystem is kind of up to people's imagination, whether it's partnering, whether it's acquisitions, as long as pharma companies, life sciences, medtech companies are able to tap into it. I think that's what we eventually want that to happen. But yeah, we are keeping a close track of how not only these firms, but there's a longer list of these firms who are close to this that we are tracking. So interestingly, we covered a lot of things today in the past 30 minutes. We talked about what is hyper-personalization, the term that we started off with. We looked at some of the changes in preferences that PCPs, customers have, how technology in itself is playing a role or maybe not in helping advance the case for hyper personalization, and then looked at some of the players out there in the market who with their technology platforms or domain centricities, etc., are trying to aid that. I know we can continue having this debate whether or not it works till the cows come home, but the fact of the matter is that we have come a long way from where we were. If we go 5 years back, 10 years back, 15 years back, there is a natural progression that is happening. And what I take heart from is in my conversations when I have this with different industry constituents, especially some of the specialist firms that are coming up in a big way, how much of attention is going to it, how passionate people are about this topic. And even though there are no plug and play solutions available for all the use cases out there in the market, but the pace at which these solutions are coming up, I think definitely gives me confidence that we are in a much better space and heading towards a much better space. So that's that. So on that note, I don't know, Durga, if you have any closing comments before we just take up a few questions and then wrap up the discussion.
Oh, I think you've summed it very well, Abhishek. I probably only, and we are definitely on the journey, and it's definitely accelerated. It's not going to take a backseat. It's going to happen. So everyone should be watching out for what the top players are doing now that there are some changes in the way the large players are operating, the new entrants in the market. So there's a lot of push from everyone in the industry, right? There's push from the demand side, there's push from all types of players on the supply side. So there's almost, everyone wants to make it happen. So I think this will happen. Maybe not how a drug comes to market, not as many years, but sooner than that, right? And the biggest challenge probably would be to really make sure that our teams internally are functioning together and bringing that data that we're talking about together, right? Because that's really the key. That's probably the foundational element that's needed to make all this happen.
That's great. In fact, let's take the last comment that I see here, which is around uh, marketing and medical work with these same customers and can learn from each other at an insight impact level. And if you were commenting on it, I mean, how I think that was a question from Michelle earlier, and I think this brings to bear how much of collaboration that is needed from both medical affairs and marketing in trying to understand the insight and how to determine and actually conduct impact analysis around how the pathways to adopt. Compliance rules have to be followed, but can't be used as a reason to say no. And that's a big one because there is a comment from Sanjeev also, which is mentioning this aspect of compliance and regulatory challenges in the market. This is something we did not touch upon in our discussion, but that's one of the elephants in the room, isn't it?
Absolutely, absolutely. But people were using it as a reason earlier, like the unknown user has mentioned it. It can't be a reason anymore, right? You need to figure it out. You can't say that, hey, I'm bound by regulatory requirements. Yes, there will always be regulatory requirements, but I think you need to figure a way out, right? I think there's uh, you see regulatory bodies also not being as rigid anymore. So pick any example, pick smart medical devices. They are changing their ways. They are now they are now open to deploying AI in the field. That's a big leap, right? I mean, I think that will happen. I don't think we should sit down by saying, hey, this is not probably regulatory compliant. We should start thinking about it, because the regulatory bodies will also turn around soon.
Absolutely. But I'll put a cautionary statement out here because there is a lot of hustle that happens on the tech side. And when tech starts, that hustle starts to merge into the pharma side, it becomes a bit more amplified. We have seen what happened with Theranos. We don't want repetition of under promised. I'm using
Yeah.
very light terms here, playing out here, but obviously within the guardrails of regulations, still, I believe there is a lot of headroom to innovate, which we see organizations doing. And in fact, some of the trailblazers we are covering, some of the major platform players that we covered, we are already noticing, I mean, a slew of innovative ideas come through. And especially the long tail of venture capital invested firms that we are witnessing. And if you walk down the aisle of any life sciences conference these days, people, every new firm that you walk into has some or the other interesting use case on which they have built their entire story. So there is headroom, there are possibilities, and I'm pretty sure we are going to get to a better situation than we were earlier.
Yeah.
All right. On that note, I think let's call it a wrap. This was a nice discussion. Especially thank you to the audience for asking, sharing so many comments and questions, which were like really insightful. There are a lot of money statements. I don't want to call out one as the money statement of the day coming from the audience, but really, really learned from some of the insights coming in.
Absolutely. I think there was some. This was a great audience, I should say. I think they were having their own conversation. I mean, the regulatory piece, we were not talking about it, but it popped up, right? That's really great. So I think it was great talking with you, Abhishek, and also all the people who joined in.
Thank you, Durga. Thank you all. We'll
All
come
right.
back, watch this space for more, is all I'll say.
You had to say that.
All
All
right.
right. Bye, everyone.